Welcome to our channel HASHMICLINICS.
All right, welcome. Today, we're going to do a deep dive into ARECA CATECHU. Now, most of us know it as a powerhouse for worms, and it is. But our focus today is going to be on the underlying physiological action that really governs its entire remedy picture. Understanding this is what allows for precise, confident prescribing well beyond just helminthiasis. So, if you want to truly get ARECA, you have to start right here. It is a powerful parasympathetic mimetic. This means it stimulates the rest and digest part of our nervous system. And it's this action, stimulating both muscarinic and nicotinic receptors, that is the common thread tying everything together, from its effect on the gut to the pupils to salivation. Grasping this concept is absolutely fundamental.
And that core action, well, it leads us directly to our one-line clinical summary. Yes, it is the quintessential tapeworm remedy, no doubt. But its influence extends just as powerfully to the pupils, the salivary glands, and the entire motility of the intestines. So let's unpack how this single physiological mechanism creates such a diverse clinical picture.
Okay, first things first. Let's ground ourselves in the foundational profile of the remedy itself, where it comes from and what makes it tick. The remedy comes from the dried nut of the ARECA CATECHU palm, commonly known as the betel nut. We prepare it either by trituration or as a tincture. But what's inside that nut is what really matters. We're talking about a powerful complex of alkaloids, with arecoline being the main player. It's the action of these constituents on the nervous system that produces the remedy's profound physiological impact. All right, with that foundation, let's start building the general picture of the patient who might need a retrokine. We'll kick things off, as always, with the mental state. Now, one thing you'll notice right away, the mental picture here isn't as richly detailed as, say, one of our major polycrests, but don't let that fool you. What we do have is incredibly significant, a keynote of restlessness, a kind of mental uneasiness, and a very notable impatience. Even though it's a limited picture, these mental symptoms can be the absolute key that unlocks a case, especially when the physicals are all pointing in this direction. Now let's move to what is an absolutely crucial aspect, its organ affinities. ARECA really focuses its energy on three very distinct and primary spheres of influence. So, number one, first and foremost, helminthiasis. This is its claim to fame, right? When you're thinking of remedies for intestinal worms, ARECA has got to be right at the top of your list. It has a massive clinical reputation here for a very good reason. And what's really fascinating is the specificity. Its main target is the tapeworm tinea. And here's a huge clinical pearl. It acts as a true tinea fuge, meaning it expels the worm without you needing to follow up with a purgative or laxative. It's also widely used in veterinary medicine, especially for dogs, but, and this is a big but, you have to be incredibly careful. The crude substance can be toxic, so much so that an isolated alkaloid, tenaline, is often considered safer for animal use. Okay, let's move on to its second major sphere of action. And you'll see how this connects right back to that parasympathomimetic nature we talked about. We're talking about the eyes. This comparison to ezerine tells a fantastic clinical story. Look at the dynamics here. Arecoline, our remedy's main alkaloid, produces a more prompt and more energetic contraction of the pupil. Sure, the effect doesn't last as long as ezerine, but that rapid, powerful meiotic action, that's precisely what can make it so valuable in the acute management of conditions like glaucoma. And for our third sphere, we're moving to the mouth and the salivary glands. And let me tell you, its power here is, well, it's profound. In fact, its ability to promote salivation is said to surpass even that of pilocarpine. So that incredible, powerful, excessive salivation, ptyalism, that is a keynote you just cannot forget with this remedy. But it doesn't stop there. It's remarkably versatile in the mouth. As an astringent, it's excellent as a gargle for bleeding gums. It can help with painful ulcers, and we should also remember its long traditional use for hardening gums and for general oral hygiene. Okay, so we've covered the big three, but ARECA's influence doesn't end there. Let's broaden our view a bit and look at some other really important clinical applications, particularly in the gastrointestinal and cardiac systems. You know, that same promotility effect on the intestines that expels worms, well, it also makes it a fantastic tool for long-standing, obstinate constipation where other remedies might have failed. And check out this very specific keynote, the pyrosis, or heartburn, of pregnancy. That is such a characteristic indication, and you'll often see it prescribed in low potencies like 1x or 3x for this. Now, its effect on the heart is really unique and precise. In non-toxic doses, it increases the amplitude, the sheer force of the heart's contractions. But, and this is the crucial part, it does this without increasing the rate or frequency. It's a subtle but very important distinction to remember.
All right, as we all know, knowing the remedy is only half the battle. Prescribing accurately means differentiating it from its closest neighbors. So let's do a little comparative work now to really highlight what makes ARECA so unique.
In the context of worm remedies, this comparison is absolutely essential. With ARECA, the irritation is primarily centered on the digestive sphere. This is a world away from the profound nervous system irritability of SINA, with its classic nose-picking and teeth-grinding. And it's completely different from the marked, localized, maddening anal itching that just screams teucrium.
And of course, it's not just about Semenschina and Teucrium. When you're thinking tapeworm, you absolutely have to keep other major tenifugaries like Filix moss and granatum in your differential. And for its ocular symptoms, you should always be comparing it with remedies known for their effects on vision like Josemium and Carbosulf.
Finally, let's get practical. We'll wrap up by talking about the nuts and bolts of prescribing and, this is incredibly important, the crucial safety considerations that come with this substance.
So, for administration as a tenifuge, here's a key practical consideration. Using coated pills is often recommended to prevent any gastric irritation and to make sure the remedy acts where it's intended. And as we've mentioned, for local use like an astringent gargle for bleeding gums, a diluted mother tincture is still the preferred preparation.
Potency selection really just follows standard homeopathic principles. Lower potencies, from mother tincture up to 3x, are typically what you'll reach for when dealing with localized physical conditions like the pyrosis of pregnancy or for topical use. But when you have a case where the mental generals and the complete symptom picture clearly correspond to the remedy, that's when you'd consider your higher potencies, from 6C upwards.
Now, this is a non-negotiable point of clinical awareness. We absolutely must be fully cognizant of the profound toxicity of the crude substance. Chronic betel nut chewing is a major public health crisis in many parts of the world, directly linked to awful conditions like oral submucosal fibrosis and cancer. This stark reality is a powerful reminder of the safety and the principle of homeopathic potentization, which allows us to harness the substance's therapeutic properties without its toxicity.
So I'll leave you with a clinical question to consider. Given its profound and direct action on the parasympathetic system, in what other conditions, maybe those marked by autonomic dysregulation that fall outside its classic keynotes, might ARECA prove to be a valuable, yet currently overlooked therapeutic agent? It's a question worth reflecting on in your practice. Thank you.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.